Aging is a natural process that brings wisdom, experience, and a sense of fulfillment for many. However, with age comes certain habits or behaviors that, while perfectly normal from the perspective of an older adult, may unintentionally annoy those around them. These habits can affect interactions with family, friends, caregivers, and others in the community. The purpose of this piece is not to criticize or stigmatize older adults, but to better understand the behaviors that can be perceived as frustrating by younger generations, and to promote empathy and solutions for improving intergenerational relationships. While some of these habits are simply the result of aging, others stem from deeper social, psychological, and physical changes that take place over time. As society becomes increasingly aware of the aging population, it's crucial that we recognize both the challenges and the positive contributions that older adults make. At the same time, understanding the behaviors that may cause discomfort can foster better communication and more harmonious relationships. 1. Repeating stories or questions. One of the most common habits that can annoy others is the tendency of older adults to repeat stories or ask the same questions multiple times. This is often a result of memory loss, such as mild cognitive impairment or early-stage dementia, which can make it difficult for seniors to retain new information or remember past conversations. While these repeated questions or stories might seem frustrating to younger listeners, it's important to recognize that they are not intentional. Instead, they reflect the normal aging process or underlying medical conditions that affect memory. For family members or caregivers, it can be helpful to respond with patience and understanding, reminding them of the previous conversation or offering gentle reassurance. 2. Slow response time or movement. As people age, their physical capabilities often slow down, including their response times, movements, and ability to perform certain tasks at the same pace as they once did. While this is a natural part of aging, it can sometimes create frustration, especially for younger individuals who may not be as patient. For instance, when an elderly person takes a longer time to move or respond to a question, others may feel rushed or irritated. The key here is to recognize that these changes are due to physical limitations, such as joint pain, decreased flexibility, or slower reflexes. Patience is crucial as many seniors still desire to maintain their independence but require more time to complete tasks. 3. Excessive complaining about health issues. Many older adults tend to focus on their health problems, which may be due to chronic conditions, physical discomfort, or the psychological effects of aging. Constantly discussing health issues or complaints about pain can be draining for the people around them. While these complaints are often genuine and rooted in real physical or emotional pain, they can become repetitive and exhausting for caregivers, family members, and friends. However, it's important to acknowledge that for some older adults, health concerns may dominate their daily lives, making it difficult for them to focus on anything else. To support them, caregivers and loved ones can actively listen, offer empathy, and encourage seniors to discuss their concerns with medical professionals. It can also be helpful to gently steer conversations toward positive topics to balance the negativity. 4. Being overly dependent on others. As people age, they may lose some of their independence and need help with daily activities such as dressing, bathing, or cooking. While it's natural to require assistance as we grow older, excessive dependence on others can be frustrating for family members or caregivers, especially if the senior feels unable or unwilling to take on even small tasks independently. Older adults may feel vulnerable or embarrassed about needing help, which can make them reluctant to ask for or accept assistance. The frustration from caregivers often stems from their overwhelming responsibility. It's essential for family members and caregivers to encourage independence as much as possible while also offering help in a way that preserves dignity and fosters a sense of self-worth in the senior. 5. Speaking loudly or repeating themselves. Hearing loss is a common issue for many older adults, and it can lead them to speak loudly or repeatedly ask others to repeat themselves. This can be especially difficult in social settings or family gatherings where others may become frustrated with the constant need for repetition. For the elderly person, speaking loudly or asking for repetition is not a deliberate action to annoy others but a response to a real hearing impairment. Patience is essential in these situations, and it's helpful to provide accommodations such as using hearing aids, reducing background noise, or speaking directly to the person at a comfortable volume. Additionally, loved ones can encourage regular hearing tests to ensure that seniors have the proper devices and treatment to help with hearing loss. 6. Offering unsolicited advice. Older adults often feel a sense of responsibility to offer advice based on their wealth of experience. While this advice is usually well-intentioned, it can come across as intrusive or patronizing, especially if it's unsolicited. Younger generations may feel that their independence is being undermined, especially if they have their own ways of doing things or making decisions. This tendency to offer unsolicited advice can stem from a desire to protect loved ones and impart wisdom. However, it's important for seniors to recognize that times have changed and younger individuals may prefer to make their own choices. Family members and caregivers can encourage open discussions where advice is offered when requested, rather than imposing it without invitation. 7. Being pessimistic about change. As people age, they may become more resistant to change or reluctant to try new things. This can manifest in negative attitudes toward technology, social changes, or even lifestyle modifications. For example, older adults may express frustration with new technology, such as smartphones or social media, or may be hesitant to adapt to changes in society, such as evolving cultural norms. These behaviors may be driven by fear of the unknown, nostalgia for the past, or a sense of loss of control. It's important to approach these situations with sensitivity and understanding, encouraging seniors to embrace change at their own pace while offering support in learning new skills or adjusting to new environments. 8. Clinging to the past. Many older adults have a strong attachment to their memories and past experiences. This can lead them to constantly reminisce about the good old days, which may be seen as irrelevant or tiresome by younger people. While reminiscing is a natural part of aging, excessive focus on the past can alienate those around them. Family members can help seniors by engaging in conversations about the present and future while also encouraging them to reflect on their life in a way that is meaningful to them. Creating opportunities for seniors to remain involved in current events or new hobbies can also help them stay engaged in the present. The habits and behaviors of older adults that can sometimes annoy others are often the result of natural aging processes or health-related issues. These habits, including repeating stories, slow movements, excessive complaining, and resistance to change, can be frustrating for those around them, but they also serve as reminders that aging is a complex and multifaceted experience. To foster better relationships with older adults, it's important to approach these behaviors with empathy and understanding. Recognizing that many of these habits are not intentional allows for more compassionate and patient interactions. By providing support, encouraging independence, and engaging in open communication, we can improve the quality of life for seniors while also strengthening the bonds between generations.